Hello, friends. Jasmine Vializ here. Welcome back to Inlera University. Today, we are having a conversation geared towards our healthcare administrators and aspiring healthcare administrators looking to get their MHA. We're having a conversation with someone that we've had in this space before. And if you're new here, you may not know that. This is Inlera University. And in this space, we focus on alleviating the stress and confusion in the business of healthcare. And healthcare administration, we'll call it, is the nucleus where everything happens and allows us to make sure our organizations are working soundly and hopefully being led in the right direction. So today we're bringing back Rene Lumene for a conversation around if you went down the path of healthcare administration again, what would you do differently? And so Rene Lumene, welcome back.
Thank you. It's always a pleasure to be back. Great question, Jasmine. That is something that I always think about. And if I could do it all over again, whether I have a bachelor's degree or I'm completing my master's in healthcare administration, I would be looking for an executive leadership training program within a large healthcare system. And the reason why is because they are basically grooming you to be a senior executive. And during these programs, it's pretty intense. And a lot of time they are very competitive. And, they might be selecting 5 candidates per year. Sometimes it might be just 3. But nonetheless, there's a lot of healthcare systems throughout the United States. And so it's just a matter of applying, especially when you're young. Sometimes you will have to go to Idaho. Sometimes you might have to go to Minnesota or Arizona, but you have to go somewhere. And usually within that 1 to 2 year, you are basically either over a service line, whether it's orthopedics or neuro, peds, whatever it might be, or multiple service line. And then you are constantly being mentored by a COO or even the CEO or maybe a VP. And I think the beauty of it, they're basically just grooming you, getting you ready so that way you can be the next leader for another hospital. And so usually what happens is that once you complete the program, if you do well enough and you make those connections and the physicians love you, then usually they'll try to wait until there's an opening and basically slide you into one of those roles. And again, it could be a CEO position if you're that good, or a director position, a VP position, or even a COO position. But again, that's the beauty of it, right? I mean, you come from school, you get groomed and trained, and you're already a senior executive. And so that is the route. If I could do it over, I would have taken.
What pain do you think that would have alleviated for you in the process?
Oh my goodness. It would have allowed me to be a high earner early on, right? But also too, that I wouldn't have had to start all the way down from a practice administrator or practice manager, if you will, right? Now, and again, for everybody, it's different. And I think there's value in starting from that and then working my way up like I did in my career. But, for those of you, I think that are very motivated, I would say to go that executive route. But also too, I think the pain that that you could avoid too is sometimes when you're starting from the bottom and you're trying to move your way up, sometimes you may get looked over, right? Because at least in my experience, there's in the healthcare industry, there is nepotism, right? There's CEOs and VPs, they'll bring in their son, they'll bring in their, family member or close friends. And this is a real thing. It does happen. But it doesn't mean that you can't be an executive in a different organization, right? And this is why I truly believe if you're not getting what you are getting in one organization, seek joy elsewhere and find that position somewhere else. And that's perfectly fine, right? But that is something that you can avoid if you go that executive route.
That's so good.
Mhm.
Follow-up question for you. So when someone is doing an MHA, at what point in their path would you recommend they start looking for this kind of program? So you're in school already, you're studying, or you should do this before you apply, or give us a little bit about when that should happen.
Yeah, absolutely. I think when you're at least halfway through your program, and the reason being is because when you're halfway through the MHA program, start looking at the hospital systems in certain areas, whether it's like John Hopkins, or if you want to, work with the VA, whatever it is, start looking to see what executive leadership program they have and start looking at the requirements. Because if you have a year or 2 years left before graduating, then at least it'll give you enough time to start working on those requirements. So that way, just before you graduate, you can start putting out your applications. They typically, I want to say sometime in the spring or even in the fall is when they start accepting the applications. So that way it'll give you the necessary time to meet the requirements and make yourself as competitive as much as possible, because they're looking at your GPA, they're looking at um, if you wrote any research paper, they're looking at if you have any prior experience. They're looking at so many different things. And so this is why a lot of time students, when they're in school, they're trying to do some form of internship or externship to gain that experience that they need to make them more competitive.
Oh yeah, that's so good. And I want to also do a follow-up question or comment really around something that you mentioned when you were speaking earlier around the starting at the bottom, because I think that some people don't know the hospital sector's structural organization. So when we talk about leadership levels, that when someone goes through an MHA program, they're looking to go directly into some sort of leadership role. So when we talk about the structure of a hospital and the roles in leadership, the practice manager role is actually in a stepping stone to hospital leadership. Will you speak to that a little bit, just so folks can understand? And I say that because sometimes we talk about in a healthcare practice, like an independent medical practice, that structure is slightly different, right? Because I'll say the top of the rung, so to speak, is a practice manager, practice administrator in that environment. But in a hospital, it's a little different. So you speak to that a little bit for me.
Yes. I'm glad you actually brought that up, right? Because so for a lot of you guys, hospitals do not employ physicians, right? But a lot of times, these large healthcare systems, they will create another entity called a physicians group. In that physicians group is where all the medical practices will fall under. So anytime you hear practice administrator, practice manager, office manager, you're under the physicians group, right? But on the hospital side is where you hear a lot of the healthcare administrators or operation administrators. I mean, the name changes based on organization. And so if working in the hospital setting is where you truly want to work in and be a healthcare administrator over a service line, like I kind of mentioned before, whether it's neurology, orthopedic, pediatric, oncology, I mean, whatever it is, then yeah, you want to make sure that you're either have done some extensive externship within the hospital setting, working in various service lines, or even starting off as a supervisor working in one of those service lines, because it'll easily make that transition a little bit easier. Because hospital, it's a different beast within itself, if you will, because there's a lot of interdepartments that have to work together, right? And so as a healthcare administrator, you have to understand how all these other departments can impact the patients that's coming to your department, and just having that understanding versus being a practice administrator or practice manager that is solely on the outpatient side, if you will.
Absolutely. I love that. Thank you so much for speaking to that and clarifying. I like to think of a hospital system as like a very complex network. It's like things are working together. There is kind of this nucleus that everybody's orienting back to, like the center, but there are all these branches that
Yes,
intertwine
absolutely.
and set some points, and then they come back to connect to this nucleus. So really,
Right.
really wrapping your head around the differences. If you enjoy the energy of a hospital, and it's always been something exciting for you, that just like that kind of knowing more deeply what's happening in the hospital sector, and getting it is a different energy than a private practice,
It is.
and so
Hmm.
knowing that there are different paths, we don't really speak to that a lot on this channel, so I want to make sure we illuminate that, especially because it's necessary for our folks who are new to healthcare in the US to be aware of,
Hmm.
because it is different in other areas of the world where it really is only a hospital type environment, and everybody works underneath that one
Hmm.
uh, environment. There isn't necessarily, or the other way around. There isn't a direct hospital, and there's only independent practices. So yeah, so good. So Rene, thank you so much for being here. You guys, if you enjoyed this conversation today, know that here at Inlera University, we bring experts like Rene in all of the time. We also have membership now. So if you're interested in getting more deeply connected with folks like Rene and getting some additional training and resources right at your fingertips, we have accessibly priced memberships. So you can check those out in the links in the description box below. And also, Rene has so graciously extended a hand to those of you who are interested in getting into healthcare administration. So Rene, would you mind sharing how people could get in touch with you? And I will also make sure those links that you share are in the description box below.
Absolutely. You can send me an email at rene@mpmastery.com. That is RENE@mpmastery.com. Or you can find me on LinkedIn. Just type my name, Rene Lumene, and it should pop up. You'll see, a picture of me, and just request to connect and send me a message, and we can take it from there.
So great. Rene, thank you so much for sharing your expertise with the community. You are always a joy to have on the channel. And I look forward to
Well,
seeing you on the next video.
it's always a pleasure. Thank you, Jasmine.